What's up, brothers and sisters? It's Xavier Best with the Exact Facts. On today's episode, we'll be talking about an issue of national importance, and that's the pharmaceutical industry, what I like to call the pharma industrial complex. What is the pharma industrial complex? Well, the pharma industrial complex is a web of businesses, politicians, and PBMs, that's something I'll talk about later, that work to distort the market so that monopoly rights can be granted to them. They can raise our prices sky high. They can box out generic manufacturers. We continue to suffer through out of our pocketbooks, out of our wallets. We can continue to suffer through how much we pay and how much we suffer health-wise. And I think one of the things that we have to do combating this is to think of another way to reimagine what a healthcare system would look like in a society that isn't driven by profit, but is driven by human need and consumer interest. And part of that is getting ourselves out of this box where we think that if you pay more for drugs, that means the quality is better. Quality and cost is not usually aligned. Sometimes quality is measured by how intelligent you're making your decisions in the marketplace. What are your specific needs? Are these needs dealt with better holistically rather than pharmaceutically? These are all things I think that we ignore in the conversation in the health debate in America because we're so obsessed with this idea that money equals power and power equals legitimacy. Power is not legitimate. It usually just requires a little inspection. So I'm going to inspect the drug industry today and tell you what's wrong with it. Whenever we're talking about any industry and we're talking about the political power of that industry, I think a good place to start is to look at the money. Follow the money, as the phrase goes. Well, when we're looking at the pharmaceutical industry, the United States commands 45% of the total pharmaceutical sales globally in the world. 45%. In monetary terms, that's 446 billion with a B dollar. That's so much money. And when we're looking at that much money, it's natural to look, is that much money translating into the halls of Congress? Well, one way you can look at that is through a website called Open Secrets. According to Open Secrets, per capita, a Democratic senator receives about $50,000 from the pharmaceutical lobby. Likewise, a Republican senator receives a per capita average of about $30,000. So naturally, when you have this kind of influence, you'll see it reflected in policy. What are some of those policies? Well, for one, you have laws in the United States that allow consumers to be marketed drugs on television. Most countries don't have that. In fact, the only other country in the world that allows television advertising for drugs is New Zealand. So you have the United States and New Zealand, only two countries that have on-air advertising for drugs. Furthermore, you have this structure, this economic structure that boxes out generic manufacturers and doesn't allow them to compete on an equal playing field. This is a direct assault on the so-called free market principles that teachers and professors love to champion in classical economic theory. This has nothing to do with free markets. It's about monopoly pricing. What is monopoly pricing? Monopoly pricing is when one company monopolizes on the technology and research for drugs. They put patents on it and then they drive up the price because you have no alternative to go through. That's a way of tilting the market away from consumers and tilting it towards the industry. There's no consumer protections. The FTC has no regulatory power over these industries, and all that creates a toxic environment where bad behavior is incentivized. And what's one of the leaders in motivating this bad behavior? Well, if I had to look down a list of things that motivate this bad behavior, I would place at the top what's called a PBM. What is a PBM? Well, a PBM is a pharmacy benefit manager. Pharmacy benefit managers have disproportionate power over the drug system. How? Basically, they buy off pharmacies and they buy off drug manufacturers and they incentivize them to drive up prices while boxing out competitors. So one of the biggest PBMs in the world right now is CVS Caremark. And CVS Caremark, they created a system where all of the pharmaceuticals not only go through CVS pharmacies, the money stays in the CVS network. So it doesn't go outside the network of CVS. It all goes back in their pockets, and you have a system that's driven on profits and rebates and not human need and human health care. And that's another disadvantage that we have in the US system. So when we're looking at this system, we have to look at the economics of it. We have to look at how PBMs and pharmacies are colluding, much like cartels in preventing competition between each other. I mean, if I could think of an analogy, for a PBM, if anybody is a fan of Marvel Comics, think of Thanos with the Infinity Stones. That's a PBM. He's coming to our universe and he's preventing all the other competitors, the generic superheroes, so to speak, to fight with the supervillain of the PBM. So that's one issue I want to point to. And lastly, when we're thinking about this health pharmaceutical industrial complex, as I like to call it, we have to think about what are the health outcomes in the United States when you juxtapose it with other countries. So if you look at the World Health Organizations, they give a list of the top 10 causes of death by country. So in the United States, the leading cause of death is heart disease, what's called ischemic heart disease. Heart disease is the biggest killer in this country. It kills about 1 in 4 Americans. In the black community, it kills 23.8% of black Americans who suffer from early death is from heart disease. So as anyone would think, this is something that we have to really key in on as a thing that we have to combat. Now, what's the country that has better outcomes than America? That's a country like the Netherlands. The Netherlands, in their World Health Organization statistics, in 4 categories out of 10, you notice that they're decreasing the incidence of certain health ailments, whereas in America, they're only decreasing in 2 categories. Furthermore, in the Netherlands, you're half as likely to get heart disease as you are in America, 7% to be exact, whereas in America, you're about 14% likely to get heart disease. So when you look at these disparities based on country and control for things like costs, so for example, in the Netherlands, they don't spend as much on pharmaceuticals. In America, they spend more. But why is the Netherlands more healthy? And I think it's because they're working on a model of accessibility and not profit. I think when you make profit the center of your health system, you incentivize, as I said, bad behavior. You don't have medicines that are designed to enrich us and nourish us, but you have medicines that are designed to hook us and get us addictive to different controlled substances. So, and this is another thing I wanted to get into. All this is happening in the context of an opioid crisis. Opioids are drugs that are being abused on a massive scale right now, and they're being in large part motivated by this pharmaceutical industry that is essentially a gateway into opioid abuse. So one of the biggest opioids that is really getting people hooked is a drug called fentanyl. And fentanyl is a drug that's in a lot of pharmaceuticals. And if you look at stats in the DC area, the Washington DC area, the nation's capital, you find that 80% of opioid related deaths are from African Americans. This is where you see the largest percentage of African Americans dying from opioid deaths. And it's traceable to this drug called fentanyl. And fentanyl is a drug that is about 50 to 100 times more potent than morphine. So, and morphine is a drug that was famously used in war zones. So you see, like, we're using these painkillers and these drugs that aren't really getting people at a healthy level of living, but they're actually getting people hooked, and they're fueling this cycle of profit and greed and accumulation. And I think in order to transcend this, we have to break out of it and start looking at more accessible, maybe even holistic approaches to our healthcare, where we're not medicating ourselves on these synthetic products that are produced in labs without any transparency. And one of the last things I think we should really talk about is how the federal government has abdicated its role as a regulatory agency in dealing with the sweeping influence of these drug companies. So, for example, one of the things that has really devastated, I think, our health system is this rise in what are called acquisitions and mergers. And in these acquisitions and mergers, you have these nice arrangements between drug manufacturers and pharmacies. And even recently, you had this merger between Amazon and PillPack. So people are, getting their drugs mailed to them, mailed to order drugs, almost like in the same way you would order books or sunglasses. And the FTC, and when they're looking at these arrangements, and these are clear monopolistic organizations that have just disproportionate influence in the marketplace, the FTC is basically like taking their hands off the wheel and letting the manufacturers and the pharmacies drive us. And I think if you're letting those organizations drive us instead of government institutions that are at least formally accountable to the public, then we aren't going to be healthy as a country. We're going to drive ourselves into debt. We're going to drive ourselves into social destruction and disunion. And I think we have to do everything within our power to prevent that. And these are all ways that the drug companies monopolize on the influence on the political process and the culture through the advertising. And so lastly, and I like to end each video with the solution, there are viable solutions to deal with this problem of the influence of drug companies. And one of the ways we can deal with solutions is, our introduced solutions is establish a national healthcare program where we're in line with other countries where we don't have to rely on the insurance corporations, or we can actually negotiate drug prices, which is forbidden under US law. There is no government purchasing power that can counteract the power of these drug companies. So we have to have some kind of way that the public can intervene and control drug prices, and not the so-called market, which I've already illustrated is very much organized on the lines of monopolies and patents, where you don't have generic options or holistic options to heal yourself. So lastly, I want to talk about a book that I'm reading now. And that book is called The Consumer's Republic. And they basically talk about the politics of mass consumption in post-war America. The author of this book is an author by the name of Elizabeth Cohen. And she talks about how in the aftermath of the Second World War, you had this big economic boom where you had this linkage between consumerism and citizenship. So one of the ways we express our citizenship as Americans is through our purchasing power. Because it's basically this idea, if people spend, it'll grow the economy, people will be able to hire more, all the prices would stabilize, so you wouldn't have like crazy out of control inflation. And that's one of the things that was very popular. And out of that consumerist movement, you also had organizations that came to protect the consumer. Organizations like the FDA, the FTC, regulatory organizations that was designed to prevent the marketplace from just running over everybody and having a barrier between the buyer and the seller. And I think over time, as you've seen this just monstrous growth of the pharmaceutical industry, you've seen the regulatory organizations go into retreat. They've abdicated their responsibility to the citizen and to the consumer, and they basically began to follow the dictates of the people who are paying them. And I think one of the ways of reversing that paradigm is educating ourselves about the history and the politics of our country. In between 1945 and 1970, there's about 33 consumer protection organizations that were launched. Why can't we launch more? Why can't there be a consumer protection agency that forbids the direct advertising on television of pharmaceutical drugs to consumers? That's something that they don't have in other countries. It's only New Zealand and America. So this is something that we have to really key in on if we want to see our society change for the better and for our children and hopefully for our grandchildren. This is Xavier Best with the Exact Facts, signing off. Peace. I got. The PBMs are like Thanos with the Infinity Stone, and the generic drugs are like Ant-Man because they not even in the picture. like in the Marvel movie, I don't know. Like they're not even in the movie. Is that a bad analogy? Okay.